This is Steve Zeltzer with Workweek. City workers of San Francisco, as other public workers around the United States, have faced an attack on their conditions, union busting, privatization, and outsourcing. And today, the city workers of San Francisco, including SEIU 1021, are in negotiations for a new contract, along with other city workers. And joining us is John Wadsworth, who's one of the members of the negotiating committee, who is facing some of these issues. Welcome, John.
Thank you. Thanks for meeting me today, Steve. I like to start with introducing myself. You know, this will be my third time with the contract and negotiating team with 1021, and you know, I have some good ideas. You know, that I'm hoping that will make it into the contract. The last contract that we negotiated, you know, there's several provisions that I was able to support and get into the contract that I was never able to enforce those, some of those provisions. So
well, the enforcement is another whole issue, whether the union officials support them. But I mean, today with COVID, city workers have died who shouldn't have died in San Francisco. Was the city prepared for the COVID crisis?
I mean, from my perspective, I mean, the city has done, you know, a moderately well job at dealing with, you know, COVID. But you know, it feels now like it's being, you know, much politicized, and you know, and there's regulatory questions about their regulatory rules that don't make a lot of sense to, you know, persons in the union and persons like myself. But I'll give you an example. Like today, I'm going to go to the city. I'm going to go to the hospital to meet with some of the members to ask them questions about, you know, what it is, the issues they're having at present day, you know, so that I can formulate some ideas to what might go into the contract, you know, what I might support or fight for, or, you know, argue, you know, with the committees and teams about, you know, what would help the workers.
Well, one of the issues around COVID is that workers who are vulnerable have been put on the job. This guy Ludwig from the Department of Public Health died as a result of being forced to go back to work frontline and not being properly protected with PPE, N95 masks. People have died who shouldn't have died.
Well, I'm sorry to hear that. You know, you mentioned that, and I hadn't heard of this person. You know, I'm really sorry to hear about that. You know, we've been in negotiations over COVID for several months. Right now they've kind of ended. You know, one of the things that I was able to do myself was to get the N95, essentially approved for, you know, free of payment, you know, for every city employee. That was my part, was to you know, bring in the N95, make it available to everybody. I don't know if they've done that, but I do want to tell you that there's a lot of issues right now with city workers being able to come to work, be able to negotiate, you know, for the union with the city who are not vaccinated. You know, and that's a problem, because in our negotiations with Lieutenant Kim and several other officers of the city, we meet and conferred on this, and we both sides agreed that if city employees were exempt from getting vaccinations, that they could exercise their once-a-week testing within 72 hours. If they were negative, then they could come and represent the union, talk to the members, and negotiate for the union. Currently, you know, what I'm being told from the director of pharmacy is that I can't come on campus at all without vaccinations, and that my test, essentially that the testing won't suffice, and it's not enough even if I'm negative, uninfected. And so, like today, I'm going to go to the city and see if, you know, they're going to let me on campus. I suspect that, you know, they may not let me on campus. In addition to that, the 1021, the local, has already started negotiations with the city. You know, we don't actually officially start until January, but a lot of persons have already been sworn in, and a lot of persons that were supposed to be there and part of the contract team, they're not being invited, they're not being allowed to be on city grounds if they're not vaccinated, even they're part of the union negotiation team. And the union is essentially acquiescing with the city on this. And I think that's definitely wrong. I don't think that if they negotiate and they meet and confer and it's agreed that once a week testing is okay for persons that have either religious exemptions or medical exemptions, should be allowed to, if they follow their rules, they come back with negative tests, PCR tests, or whatever kind of tests that they require within the 72 hours, they should be able to come and negotiate, for the city and represent the members.
And some of the issues that you brought up previously around outsourcing, privatization, what's happening at the pharmacy. You represent the workers at the General Hospital Pharmacy. Are those issues continuing to concern you about outsourcing and privatization?
Yes, sir. Those issues are more elevated now than they were before. But we've had ongoing issues with the head officer of a pharmacy, Mr. Woods. We've had essentially it seems that they want to outsource certain parts of pharmacy, and if they are not able to outsource certain parts of pharmacy, they want to outsource the workers themselves, not the ones that are there, but the ones that leave. If they leave, and which opens up a requisition for a permanent full-time employee, they don't fill the permanent requisition, and instead they bring in a temporary worker, with either temp. Sometimes it, like for the nursings, it's the P103s. For pharmacy, it's usually like an outsourcing organization or business that brings in temporary workers, and it's very hard actually to function with with a revolving door of employees.
And the policy of the city, you had a whole history of corruption, of people being targeted illegally, forged documents. The district attorney has filed charges against an employee manager who was falsifying information about employees on legal settlements. The city has spent over $100 million on settlements for lawyers, for workers who have been illegally discharged. Your members came to the Labor Council, San Francisco Labor Council, to talk about the bullying, the illegal harassment. Is that still going on?
In some respects, there, it's still happening. Regarding that particular issue, I think you're talking about the EEO office, and a worker that was essentially using someone else's log on or what have you, is what I read in the Guardian. But on that program itself, with the EEO, since then, one of the things that has happened that a lot of people don't know, that have either discrimination cases or discrimination complaints or active investigations, is that the EEO office itself has been totally gutted. There's only one. My understanding is that there's only one person that remains from the original group of people. They had a half dozen to a dozen workers that were in that department, and I heard at this point that they have one that's handling cases. So that what's happening now is that these cases are backlogged, and they're not being addressed.
And what does that mean as far as management being held accountable? If they've basically closed the EEO department, if they're not pursuing discrimination complaints, isn't that a free hand for management to do what they want?
In theory, yeah. That's the managers that not be addressed or held accountable, and may go on to do the same thing if there is no accountability. I mean, the EEO office hasn't been closed, but it's been gutted, meaning that there isn't hardly anyone in there doing the work.
And there's a whole history of systemic racism in San Francisco. Micki Callahan was aware of the illegal actions by managers, the corruption at Laguna Honda of officials. None of these people were held accountable. They left. The previous manager, CEO of Department of Public Health, left under circumstances where she was providing her partner money from the city and county of San Francisco. None of these people have been held accountable. This issue of corruption in the city and county of San Francisco, why is it continuing, and what is the city and the union doing about it?
I mean, from my perspective, when the EEO was gutted, and the persons that a lot of the persons that were involved, couldn't be held accountable, and so the issues will persist. After that, I know that there are persons within the union that are supporting, different.
Has the union held any rallies against the systemic racism against city employees because of the management's behavior and actions?
I don't know of any rallies. I mean, it's since the COVID mandates here in San Francisco, a lot of things have been relegated to online and Zoom calls and those type of meetings. But I will tell you this: there are persons in our union that are trying to address, what you would call systemic racism. Now, I don't necessarily ascribe to the same structure, the same ideology that people have on systemic racism, but I know it does exist.
Well, let's talk about what the city is saying they're going to do about it. This equity plan, that they're going to address systemic racism with equity. Apparently, that means that they're going to get rid of civil service system, or so that they can bring in people that they want. You think that's going to deal with the systemic racism?
No, I don't think handing over the solution is to hand over the hiring process to another group. Okay, on the hiring side, and equity as it stands, I support equity in terms of applying some fairness and equality to a lot of processes at the hospital that that will make things more fair. In terms of promotion, hiring, reassignment, and trainee programs like the nursing training programs. Now, in respects to those provisions, I do not support equity to take over the civil service hiring processes. I think that the previous civil service process should be reinstated, and without de-identification. I think de-identification. I think the city already knows that the de-identification brought about violations of Title VII rights, and
what is Title VII?
It's a federal discrimination violation and protections, in the de-identification process with with what they moving forward to do, it essentially was violating the civil rights of persons that may be disabled, persons that were veterans of the military, possibly, and so forth.
And the issue of the outsourcing you have in San Francisco and many other cities, hundreds of millions of dollars going out to outsourced institutions. You see Healthcare 360. Apparently, the members of SEIU 1021 who work in San Francisco, including leadership members, can't even get a copy of the contract for Healthcare 360. Why wouldn't you be able to get a copy of their contract of 1021's Healthcare 360?
I mean, I don't know, what their reasons are, but there should never be an instance in which you can't gain access to the provisions that are negotiated by the local.
Do you think it's being kept from the membership?
In some cases, yes.
And why would that be?
Because there's sometimes when we negotiate in a collective bargaining unit when the final print is made when the ink is before the ink is even dry certain provisions may be changed.
Well, Healthcare 360 has got a contract with the City and County of San Francisco, and the workers there are doing the same work as public workers. In fact, your classification, other classifications at Healthcare 360, you think it's undermining public workers if you have the city is outsourcing workers to do the same work as city workers? Wouldn't that undermine and undercut public workers?
I do. Essentially, it's an anti. It goes against the philosophy of union bargaining. It's anti-theoretical to what we're.
Is it union busting?
I believe it is. I believe it is a form of union busting. The thing about it is that there are a lot of good applications and a lot of intended equity measures that are in the works right now, but in particular on the promotion, hiring, reassignment, and trainee programs, with the use of equity in certain manners, it undermines seniority. It undermines the very foundation and principles of union seniority and allows the city to hire people from the outside and take away the seniority rights of persons that have been there sometimes 20 or 30 years. They can't go into reassign to another position they've been waiting for. And a lot of these workers, the new ones, most of the new workers, they come in under some temporary work status, and because of that, they're hired into what they call the alternative provision, which is something that I was really against in our last negotiations, is that they come in on these alternative scheduling provisions where they meet and confer directly with the city to have these shifts where sometimes they work 10 hours a day, 12 hours a day, sometimes 5 days a week, 7 days a week. And essentially what it does is it supersedes the California labor rights, the labor rights here in California, which is, a typical 8-hour, 40-hour week. Now, one of the issues with that, which I'm hoping that we address some in this next negotiations, is that the alternative scheduling provision and the previous provisions on scheduling rights, they're in conflict of interest with one another, and especially in departments that have shift bids, whole shift bids, departments that have 50 people, 100 people, that participate in shift bids, some 200, 400 people in these city departments. Now, if you have half of the department that's been hired in the last 5 years, they come in through alternative shift. They're under alternative shift provisions of the contract, while the other ones still are under the previous provisions, past practice 20, 30 years ago from the beginning team. They work against one another. Management exploits these negotiations so that they're favored towards the newer employees.
Wouldn't that lead to corruption, nepotism?
Yes, it does. But I mean, the more importantly, it undercuts the fundamental principles of our union negotiations, which are based on seniority. Some of the newer persons, they don't know.
Are they union members?
Some of them are, and some of them are not.
So they may not know they even have rights to a lunch or certain hours.
Sometimes they don't, and the problem is that it's short-sighted to get these short-term gains are going to be long-term losses.
And this labor management partnership that SEIU 1021 officials have with management, you think that's a problem?
It can be a problem,
I mean, they're having negotiation now apparently secretly with Carol Eisen outside the bargaining committee. Carol Eisen announced that they're having negotiations, and their members of the bargaining committee have no idea what those negotiations are.
I wasn't aware, and I mean that.
You think that that's the principled way of having negotiations?
No, that would be a problem if that's what's taking place. I didn't know that was taking place, but I know that we did have about 2 weeks ago we had an impromptu negotiation, a meeting for the team. I know that several of us didn't receive any notice communications and weren't allowed to attend.
You think they're conniving with management?
I'm hoping not.
What did you experience the last negotiations?
Well, I mean, the leadership team on the local side, is always going to have some insight onto, and some plan as to what direction we're going to go and what is negotiable and what's not. A lot of times, we don't get that information, and so we're, like for me personally, some of the provisions that I was working on that I was, arguing over and so forth. There's a few that made it into the contract, which to me was a big accomplishment. One of them, for instance, was a provision that allowed members to meet and confer with the city over the impact of EPIC. Now that was a provision that was for DPH. And we've had that provision in effect for almost 3 years, and it's never been enforced.
So EPIC has been, some workers have charged it's used to outsource, it's used to privatize by management.
Austerity measures.
Austerity. Has that been happening in your department?
I mean, that's what we're talking about. The austerity measures in regards to how it's applied and how departments in theory are made more efficient. Supposedly
and they bring in more consultants.
Well, they bring in more consultants, but the problem is that they on the front of it. This, it said that it would be more efficient, and so you could do more with less. But as in our department, the pharmacy department, that did not happen. We need more people because there's more work.
And the issue of reparations, I know many city employees have supported that. Because of the systemic discrimination, what's happened to black, brown people, indigenous people. At San Francisco City College, they're laying off SEIU members and faculty. Community college, it seems, which should be a basic issue of the right of young people, working class people, poor people, to be able to get a college education. Has that been brought up in Local 1021?
Not that I'm aware of. Not that I'm aware of. I don't know about that particular issue, but I would be against persons being jobless at this time. I mean, we're 2 years into COVID pandemic, and this is the worst time to be laying off workers that need to be able to take care of their families and their children.
And has SEIU publicized to the bargaining team and the public about the danger of layoffs and the shutdown of departments at City College?
Not that I'm aware of.
Even though their members are being laid off?
Yeah.
What does that tell you about the union leadership that you have?
I mean, the priorities are, not aligning with, the workers. That they're not aligning with the workers, like they should. That's what it tells me.
And this issue of discrimination, it's a long history of it. Bullying, harassment. I mean, the city has paid over $100 million, yet it seems like it hasn't gone away. The city attorney, Dennis Herrera, who was involved in defending the city against illegal discrimination, paid out money. Now he's with the PUC, which also has a history of corruption, payoffs, nonprofits, privatization of Golden Gate Park, Arboretum, all these nonprofits being set up who are taking over the operations of the city. Do you think that privatization and these nonprofits, the lack of oversight, like of Healthcare 360, and the effect on workers who are being paid for by the city and county of San Francisco is an issue?
I mean, it's always an issue when union workers are being marginalized and losing their jobs and being paid less than what other workers in the city that from the same classification are making less money. That's always going to be an issue. I mean, the EEO right now is under some disarray. What I'm told is that there's solutions that are on the horizon. I know that the mayor's office hired an independent investigator to take a look at what issues that might be systemic, and I read part of the report, but I haven't fully read it, so I couldn't say what solutions may come. But I know that the city is trying to address it now. But this comes years after many actions and several discussions in front of the Board of Supervisors over the last couple of years that you yourself invited me to.
Okay, well, what do you have to say to city workers who are concerned about these issues and them being addressed?
I would say, now is the time to be very vocal. Now is the time to really talk with one another. We're going to have essentially officially start contract negotiations in January. And right now is the best time to take a look at the contract, get a copy of the contract, take a look at what type of scheduling rights that you have, what type of seniority rights that you have, and talk with your coworkers about it, because we want to strengthen those rights, not allow the city to weaken those rights. And does
that mean a contract demand that there be a stop to a halt to outsource privatization, outsourcing jobs? I mean, in other words, if they're hiring people to do your job and other city workers at nonprofits at substandard wages and conditions, that's undermining public work, isn't it?
I mean, absolutely. That's fact. This is what's happened in the last 5-7 years. My understanding is that we've had a hiring freeze. But hiring freeze doesn't mean that they're not hiring. It just means that they're not hiring and filling permanent requisitions anymore. So most of the people that are getting hired, with exceptions, very few exceptions for regulatory matters or what have you, they're not replacing those permanent requisitions, and instead they're hiring through outsource.
And the Civil Service Commission in San Francisco votes on these, yet SEIU 1021 leadership have never opposed outsourcing of these jobs. We're talking millions, hundreds of millions of dollars. Why haven't they spoken up at San Francisco Civil Service Commission challenging the outsourcing of jobs, work that could be done by city employees?
I couldn't answer that question, but I mean...
You think that they're paid off?
Hopefully not. Hopefully that's not the case. I don't...
Why city workers can do that work? Why are they outsourcing it to privately run operations?
I mean, with the hiring freeze in place and EPIC being implemented in the last 5 years, I mean, it feels very much like an austerity measure, to shrink the workforce. And right now, that
must be pretty stressful for city workers.
I mean, almost every department in the city has systemic staffing shortages. What happens when you have hiring freezes and then you increase your services or what have you, or rather you have to decrease your services, meaning that there's less city services available because you have staffing shortages that become systemic over long periods of time.
And that hurts the public. It hurts the very people that are supposed to be served by these services.
Absolutely.
Okay, well, I want to thank you very much for joining us on Work Week. We've been talking with John Wadsworth. He's a member of the bargaining committee. He's a SEIU 1021 member and works for the Department of Public Health at San Francisco General Hospital. Thanks for joining us.
Thank you, Steve.